Hello, everybody. This is Gary Rhinehart from Heart to Heart with Gary Rhinehart. I am joined today by Patrick Krause, Coalition Coordinator of the Four Rivers Alliance, which is part of the HFM Prevention Council, and James Norton, Opioid Response Program Coordinator. How's everybody doing today?
Good, thank you, sir. Very good, Gary. Thank you.
I'm glad to have both of you on, and today we will be talking about opioids, which is a major problem across the nation. And my first question for James is, what is an opioid, or what constitutes an opioid?
So, an opioid is a classification of a drug. So there's a whole number of them that fall under the umbrella, but they all have roughly the same effect of an opioid. It is an analgesic pain treatment that can range in strength depending on what specific drug you're talking about. Most are opiates, so they're based from a poppy plant derivative called thymine, but there are other synthetic ones that I'm sure we'll get into with the fentanyls that are not based upon the organic substance originally found. But they're all within the classification of an opioid.
What's the history of opioids in the United States?
In the United States, there's been a couple different uses, but the original founding of an opioid was by Bayer Pharmaceuticals in Germany in 1801. From there were even opioid wars fought between Western powers and China during the 1830s to 1860s. And really, that was when it took a lot of gain in popularity because there was so much black lung or tuberculosis, whooping cough, a lot of respiratory-based illnesses, and a number of different civil conflicts like the American Civil War that required fairly inexpensive pain treatment. So after morphine was created, it was fairly expensive, and there was a rush to create even cheaper versions.
So you mentioned morphine, which is a legal form of opioid. Can things like that, can drugs like morphine in that lead to opiate addiction?
Yes, that's probably the most common way. There's always the phrase, are you building the foundation for addiction in your life? Especially when we're looking at the other substances like marijuana, alcohol, gambling. Anything that releases dopamine, that pleasure center, can form the foundation of addiction. But a lot of people have gotten hooked from a legal prescription. The most common was OxyContin, which was banned in the 1990s, and then continued to sell in what pharmaceutical companies refer to as a blockbuster drug into the late 2000s and into the 2010s.
Yeah, you mentioned the pharmaceutical, if I can pronounce it correctly, pharmaceutical companies. They've had a history of, as I've heard, pushing these pain medications. Can you tell us a little more about that, or if that's true at all?
Yes, so it is true, and I can say to some degree Purdue Pharma has accepted some liability or has at least been found guilty. But there are a number of different lawsuits pending about the illegal distribution of opioids or the illegal pushing of opioids into the general public. A lot of the practices were to not just shape the individual doctors, because most doctors got into it for the right reasons. So you're not going to convince hundreds of thousands of doctors to prescribe a drug overnight unless you do things like lobby the boards of medicine to recognize pain as a fifth vital sign, and then train doctors to believe that if they don't treat pain, they'll lose their medical license. But it was done so it wasn't pushed as we need to sell more OxyContin. It was pushed as we need to treat pain through a good measure, and that's not exactly a bad thing. But it is when we started prescribing, high dose, high strength opioids to people for problems that, in the years before OxyContin, Purdue Pharma, and the years before a lot of the other groups like INSIS patented opioids, these were mostly cancer patient medications, end of life palliative care. And then opioids started getting prescribed more readily to more readily treat pain, and that meant people who were even having oral surgeries like wisdom teeth were getting 90-day prescriptions of OxyContin and getting hooked, especially at a younger age when wisdom teeth is usually removed.
Pain is such a tricky thing because it's something you can't detect in a test usually. And, my sense of pain is different from your sense of pain, which is different from Patrick's sense of pain. So that in itself is difficult.
Absolutely, it's really difficult to gauge pain objectively. There are some things you can try in measuring, blood pressure, pulse, and just seeing if it's constantly elevated. But you're really looking at that small window when they're in the office versus what does it look like throughout the whole day.
Yeah.
And just one of the things that Purdue Pharma did too, really, was, of course, marketed as a blockbuster drug, as a 12-hour time-release painkiller, and really aggressively marketed to general practitioners. Also, severely downplaying the addiction potential.
Yes.
That was one of the things, and really fraudulently so. They quoted a saying, in the New England Journal of Medicine, this article saying there's only 1% chance of getting addicted. This turned out to be totally untrue, based on a letter to the editor that was extracted from that journal. True, but not an actual study. So all the salespeople were of Purdue Pharma, which was really really has a lot of the blame, went out and really aggressively marketed OxyContin, the brand name, since its discovery or introduction in the mid '90s, and was as James said, found guilty. They were found guilty in a major lawsuit for misbranding in about 2007, I think it was. Paid a fine in the hundreds of millions of dollars, but they were making billions in profits from OxyContin. It really didn't change the practices. So this is I think a political issue, and people disagree, but I think it's pretty clear now, based on all the number of lawsuits from localities, states, Indian tribe, etc., that Purdue Pharma really, with its aggressive marketing of this opioid, this painkiller, really deserves a lot of the blame for what happened in the years that followed.
Do you think with accurate information, these drugs could be used as, in a medicinal way, or are they too dangerous to use in that manner and we should try to find something else?
I think the push right now is to find less addictive pain treatments, but the current guidance from the FDA is to go low, start slow, go low, and then try to find alternative pain treatments to kind of mix in. So increasing the amount of people who have access to physical therapy, which a lot of people in rural areas don't necessarily have a ton of access to, where they have to travel 50 to 100 miles to the nearest physical therapy practitioner. But how do we mix in more mindfulness? How do we mix in more physical therapy? And then how do we balance that with less addictive pain treatment? So if we can keep the doses of opioids lower, and then co-prescribe them with things like prescription strength ibuprofen, aspirin, acetaminophen, how do we get all of these drugs to work collectively? And as well as continuing to try to find a less addictive pain treatment. But unfortunately, the way that opioids work, releasing the dopamine pain chemical, or the dopamine chemical in your brain, that makes it very addictive. Anything that feels good releases dopamine, and it used that barrier to block the pain signals. And short of doing that, or short of stopping pain signals where they are, there's really not a better way, but there's a way we can do this safely. There's a way we can do this more safely, and a lot of times that means reducing the amount of prescriptions that are given out, period. So there's a degree of doing less opioids, but there's also a degree of doing better pain management that is not solely focused on opioids.
Yeah, I was talking to Pat a little bit before you came on about how in Hamilton County, our access to physical therapists, to treatment centers and the like is very far in between. Hamilton County, to my knowledge, does not have a hospital within the county limits. And I know when I did physical therapy for my neck, I went all the way to Amsterdam. And when I went for in-treatment therapy, it wasn't for chemical, it was for something else, but Four Winds was all the way in Saratoga. So it's very difficult to get all the way to these places, like you said, are about 50, 60 miles, even more in some cases, with the price of gas, the amount of times you got to go down, trying to find a ride if you can't afford those things. The med cabs try to do their best, but there's really very few drivers, if any, at this point. So It's very difficult for us here in Hamilton County to get that sort of treatment. So I was wondering, what are the symptoms of opioid abuse?
So one of the earliest signs, especially if you've been prescribed an opioid and you're starting to form those addictive behaviors, is kind of constantly thinking about it. You're really needing to set your alarm, really thinking about taking the medication even though you're not necessarily feeling any pain. So a lot of times now they're prescribing less and less. But in the earlier years of this, people get 90-day prescriptions and they maybe stop having pain around day 10, day 20. But they keep taking the pills, and that's when you're taking it no longer for a medical reason, then that's an addictive behavior. You'll start to see things in the individual like, we'll see mild at first, missing items around the house that they've pawned, to people kind of missing work here and there, to missing work quite regularly. It'll get progressively worse. And we're using a chronic disease model, and that's generally how this is. It doesn't start with heroin. It doesn't start with missing work or becoming homeless. That's the end point. Really the thing to look for now is missing items. Are they starting to miss work? Are they starting to lose track of things like not picking up their kids from school maybe a couple days in a row? Or are they no longer finding joy in things that they used to enjoy? If they loved fishing, did they go every weekend and now they're not? They haven't gone in months. It eventually absorbs your whole life, and it gets progressively worse. And the earlier we can identify it, the better.
So you mentioned heroin quickly. I was always wondering, what's the relationship between heroin and opioids, or is heroin a certain type of opioid?
So heroin was invented also by Bayer shortly after they invented morphine. The idea being it was a cheaper alternative to morphine, and this was a time before health insurance, so everybody had to pay out of pocket for everything. The idea was to kind of create a cheaper one that more members of the general public could use, again, because there were so many chronic respiratory illnesses at the time. And it is also an opioid. They're derived from the same source. Both are from the natural source of poppies that are out there. Heroin is just Schedule 2, or Schedule 1 now. But there's a time you could buy a cough medicine, and it was a readily available prescription drug. And we've since realized that it doesn't have really any medical benefits that a lot of other prescription strength opioids do. But unfortunately, that's the term, because essentially, if you can no longer get a prescription, you might then go to buying pills on the street, and then when you start to run out of money there, the next step usually ends up being heroin, just because that's the opioid you can get. Once you have that addictive cycle, it gets progressively worse. But that's the physical dependence that forms. And so in order to stop things like withdrawal, you need to continue to take opioids, and eventually that'll work its way down to heroin.
Yeah, what are some withdrawal symptoms of opioids?
So the hardest one has to be the other than the opiate-induced constipation, the slowing down and disruption of your metabolism. But one of the biggest ones is the opioid-induced hyperanalgesia. It is a problem where all of your pain signals have been sent to your brain, but your brain hasn't received it, because the opioids have released so much dopamine that your brain is no longer paying attention to its pain signals. It's being overwhelmed by the amount of dopamine released. So in order to get its message through, your individual nerve cells, say in your hands, your feet, your stomach, they've been used to firing harder and harder to get through that dopamine barrier. And when that dopamine barrier is gone, they're still firing at max strength just to try to make it through the dopamine barrier. But without that dopamine barrier, they're still firing max strength, so everything feels painful. Just the wind on your face will feel like stabbing. Just a poke would feel like you're being punched by Rocky Balboa. It hyperstimulates a lot of the nerves to fire hard to get through that dopamine barrier, and then when the dopamine barrier is gone, your nerves are still firing now. And so everything will hurt, everything will ache. Even just the slightest touches will send somebody into severe pain.
Yeah. Well, we've talked about opioids and what it can do, but how prevalent is this opioid epidemic?
So every year, roughly 1,000 people in New York State die from some form of an opioid, and it varies from year to year. We've had some luck getting it down in some areas. We've had a lot of areas get a little bit worse. I'd say especially in the COVID era, it has gotten quite a bit worse because a lot of the treatment services have been limited or in some cases shut down, like the recovery services. It was hard to have in-person meetings for a while. It is actually more prevalent in rural areas for the exact same reasons we talked about earlier, in that alternative pain treatments weren't always as available. But one of the hardest hit states have been West Virginia and North New Hampshire, and a lot of rural areas have been hit hard by this. And even if you don't think it's in your town, there were doctors in your town who were prescribing, and there were people who got hooked. And the doctors didn't necessarily mean to do this harm, but we try to do our best to reach out, to do as much outreach as we can to everybody. But sometimes in rural areas, it's just harder to get to the same populations.
So
the total number of overdoses from opioids is really hard to believe. It's in the area of 350,000 people since 1999. Last 2018 was the first year that we saw a slight decrease, probably because of the increased use of Narcan, which is naloxone, which is a opioid overdose reversal medication that's become more available to first responders, and that's probably one of the reasons that we've seen a dip. But the CDC just came out with the latest data, and 2018 went back up again. 2018, there were 71,000 overdoses. That's just opioid overdoses, not total drug overdoses, but and many overdoses involve people who've taken more than one drug. But it's usually able to pinpoint it to an opioid because if the cause of death is that respiration stops. It's pretty obvious that's the cause of death. So this is a huge public health crisis that's been going on really for a quarter century, and right now, and partly because of COVID-19, I think that it's probably safe to say that the total number of fatal overdoses this year will be up over last year. The early data is from a lot of states. The first quarter data is that things have gone up because of COVID, more isolation, less treatment, other reasons, the nature of the drugs that are circulating. So yeah, we can't underestimate really how serious this is. Even though other things, alcohol and tobacco in particular, probably are causing more fatalities on an annual basis. The opioid crisis has been devastating, and again, particularly in a lot of rural areas like West Virginia, Ohio, New Hampshire, and Maine.
Yeah, we watched that movie once, Pat. I don't know if you remember the name of it, where it was that West Virginia, I think, coal town.
It was called Oxyana. It was about a town in West Virginia, Oceana, West Virginia. Just a devastating, like many of these towns that are isolated, declining. The coal industry has gone down. A lot of high unemployment, a lot of substance abuse anyway. But the huge numbers of pills that poured into these pain pills, like Oxycontin, but others, Percocet, poured into these rural counties, and that's a huge story in itself. There's a recent book out called Death in Mud Lick about, again, another town in West Virginia, and you read the statistics on some of these small pharmacies in towns that number in a couple hundred, 200, 300 people, were selling millions of these pills. Some of them were outright, pill mills where people, these really criminal doctors were selling painkillers for cash only. People were lined up, going through them like going through a drive-in. It's devastating. That's the worst case. But it isn't only pill mills, which were really criminal retail outlets for painkillers, but just over prescribing and then over distribution of these pain medications in the millions and millions of pills pouring into these areas. We could spend a whole hour just talking about that subject in itself.
I know, but especially with Hamilton County, the opportunities to get rid of your medications are important to take advantage of. I know the DEA does their annual take-back days. They usually do one at the end of April and at the end of October. Just from this northeastern corridor from Plattsburgh down to Albany, there's about 7,000 pounds of medication taken back. And that's from drug drop box. That's not including the drug drop boxes or the medication disposal bags. So there are a lot of medications out there that we need to get rid of, and especially with COVID-19 just recently, they had to cancel the April drug take-back day.
Yeah.
One of the best steps you can take to prevent addiction, especially if you have teenagers or young children at home, is to take advantage of the take-back events and get rid of your medications.
Mm-hmm.
Yeah, that kind of leads us into prevention. But the Four Rivers Alliance in Hamilton County has participated in the DEA Take-Back Day the last couple of years. Of course, it was canceled this April. So we're trying to find other ways to reach out, because, as James said, a lot of times where addiction starts or misuse is, especially with younger people, is accessing prescription opioids from medicine cabinets and other places where they're left over, say, from a surgery, or someone is actually using them for current use. So we try and educate people to monitor and lock your medicine boxes, but we're also providing more and more a more decentralized way of disposing of unused opioids and other medications called Terra, which is a very simple drug deactivation system. It's an envelope. You put the pills in, fill it with warm water, and it has a neutralizing agent, and so you can dispose of drugs that way without flushing them down the toilet, and totally neutralizes the medication. So and James has been involved in this too, as we're actively involved in distributing these envelopes at our tabling through public health, retail outlets, and the like. So that's one way we could do. Because in Hamilton County, we only have one drug take-back box. It's at the Hamilton County Sheriff's. It's a 24/7 drop box that people should be aware of. That's one thing we'll mention this. But otherwise, I'm always hearing stories of someone will ask somebody up in the northern part of the county, I've got maybe a family member passed away or something. I have all these unused medications. What do I do with them? So we're really trying to work on that a lot.
Yeah, unfortunately, the very north of Hamilton County, I mean, it's a long drive from Long Lake Inlet, Indian Lake, to the Hamilton County Sheriff's Department here in Lake Pleasant. So it's not always seems like the easiest way to get rid of them, at least to the people up there. What should patients be asking their doctors when doctors are prescribing pain medications? Are there certain things they should be asking?
Well, I think they need to have more of an open conversation about what their pain is like, if it gets any worse or gets any better, and what their other options are. Right now, the CDC guidelines is to start low, go slow. See if there's a way to get a lower dosage and use non-opioid based pain treatment. I think some cases people be surprised what is and is not an opioid. Midol is the main ingredient is actually an opioid based medication. Codeine, which you'll find in most cough syrups, is also an opioid based medication. And really, it's important that we know what drugs and how they'll interact together, because you'll get some that are synergistic. 1 + 1 does not equal 2. 1 + 1 will equal 5. And so you want to pay attention to how whatever other medications you're taking at the moment will one affect the other. Going back to an earlier question, what are the earlier signs that somebody is using a lot of opioids? I don't think a lot of people realize that grapefruit juice will actually amplify an opioid. And if you start noticing your 20-year-old is going through a couple bottles of grapefruit juice a day, that might be one of the signs. But when you go into your doctor's office, it's important to have that conversation about what your pain is really like and what other options you have. Ask, is there a less addictive version, or is there a weaker version or less potent version that we can balance with a non-opioid based pain treatment? And what are your options for physical therapy or other non-drug based pain treatment?
I know that we mentioned it quickly, but I'd like to kind of get into what is Narcan. It's something that you hear a lot now, and a lot of public offices are training on how to use Narcan. But what is it exactly?
So it's a drug that's been around since the 1960s. Paramedics have been able to give it intravenously since before that even. The newest version is a nasal spray, and that's why members of the general public have been starting to be trained on it. It is another opioid antagonist, so it will actively bind to the same receptors that an opioid would, but instead of releasing the dopamine, the serotonin, the norepinephrine that causes the overdose, that causes the addictive behaviors, it will kick the opioid out of the receptor, then sit in the receptor, and then stop the overdose. It is a more aggressive agonist, so it will kick out the old opioids, but because it's so aggressive, it'll only last 30 to 90 minutes. So a lot of people think that, oh, well, if I have Narcan, I'm fine. Or if I've just received Narcan, so that's it, get out of jail free card. No, it's an emergency use only medication. It really can only last 30 to 90 minutes, and especially when we're talking about the addition of fentanyl to the illegal drug market, you're not always getting 30 to 90 minutes, and it's taking more and more Narcan to get people out of an overdose situation. So if you want to get trained, there are ways to get trained. You can reach out to us directly, but it's also important to remember that this is still a medical emergency, and Narcan's more like an EpiPen. And that is a temporary fix until you can get somebody to more appropriate medical care.
Yeah. So
if someone does administer Narcan, they're trained to stay with this person for 3 hours, because as it does wear off, there's the chance of going into withdrawal, or for the opioids to come back into the system. So yeah, it really is. So people who are trained to administer are trained to administer the emergency situation, but also at the same time or right before, right after, also to call 911 and get the person help, because things can happen afterwards that are a person can go into withdrawal symptoms, or if they wake up, since they probably were unconscious, they can be very distressed. So they really need more help than that emergency intervention. But it's become widely used across the country more and more, and it's really made a big difference. It's totally harmless if you give someone Narcan or naloxone is the medical name, and they're not having an opioid overdose. It doesn't harm them, so it's really, the downsides are few.
We've talked about the opioids, and the word fentanyl has come up a few times. What is fentanyl?
So it's a synthetic version of an opioid. So it's not made from the original poppy plant. So it's an opioid, but it's not an opiate. All opioids are measured in something called the morphine milligram equivalent. So how many milligrams of morphine do I need to equal 1 milligram of this stuff? So for fentanyl, it's 80 milligrams. For this even stronger ones, like carfentanil, it's 100 milligrams. So it is a medication that is used in much smaller doses, but has a very similar effect. And when taken in the larger doses, it can have an even stronger effect than opioids. The addition of fentanyl into illicit drug markets has really what has spiked the opiate overdoses. Back in 2015, we were still seeing a lot of overdoses from prescription pills, from heroin, from all drugs combined. It was around 46,000 a year. But that additional 30,000 people that we've seen this last year, a lot of that's been driven by the addition of fentanyls. Fentanyl is a classification. There's acetyl, there's diacetyl, carfentanil, and it's a whack-a-mole game trying to ban them. Every time one is banned, a new one will be made, and every time one is banned, the ingredients to make it will then be shipped in its place, and people will just mix it up in clandestine labs across the United States.
And just to kind of move back quickly, we talked about the overdose death profile, since this all started in the mid-90s. If you look at graphs from the CDC or other organizations, they generally they put it in what's call three phases. The first phase was a large and steady increase in deaths from prescription opioid abuse, and then around 2010 kind of morphed into heroin taking off. There's different theories to why heroin suddenly became the main cause of overdoses, or at least caught up to and surpassed prescription opioids. One was that big makers like Purdue Pharma reformulated OxyContin so it couldn't be so easily abused. But there was another reason is that very inexpensive, very potent heroin became really very easy to find all across the United States. So a lot of people who were perhaps had become addicted to prescription painkillers and then no longer could get them, whether prescriptions over tightened or there's more regulation, moved on to heroin because it was easy to find, did the same thing, and was less expensive. So supposedly 4 out of 5 people who are now addicted to heroin started out by using prescription pills. And now we're into phase 3, which is the fentanyl phase. Fentanyl, just because it's so deadly, even just a pinch of it can cause an overdose. And right now, especially this last year or two, we're finding it in more and more drugs, whether it's being introduced intentionally, especially cocaine. There have been a lot of fentanyl overdoses in New York State during the past few months. And a lot of it is fentanyl finding its way into cocaine. So people are taking an opioid and overdosing without realizing it's even there for the most part. There are people who do move on to fentanyl from heroin because it's more bang for the buck, it's cheaper, it's easier to get. But a lot of the fentanyl deaths have been caused by people being exposed to it through the use of other drugs like cocaine.
Yeah, I know heroin is always kind of considered the more high-profile opiate, especially because Declan Radio is also a classic rock station. So when you think of all the big names who have overdosed using heroin, it goes to show that it doesn't, like all drugs, does not discriminate between your common man and your rock stars, superstars, that this can affect anybody and everybody. One question I get a lot is, where can people who are addicted go for help? A lot of people who are addicted to things have a fear of getting in trouble, with the police, of going to jail, because they've been abusing this substance, but so they don't know where to get help or if to get help. And so what can we do to help them?
So one of the best things you can do individually is to try to help get yourself there. Addiction is often called a family disease, and a lot of the same addictive behaviors come from a need. And really, if you're going to support somebody who's entering recovery, you yourself also need to kind of get into some recovery. So if you, one of the first steps you can do is work on yourself and improve how you interact with this person going forward, especially as they enter what's going to be a very hard process. It's not always so simple to be as supportive, to know whether or not you're enabling or to know whether or not you're supporting. And it's a fine line to walk. But there's a lot of great services available, from Hamilton County Community Services to citizen advocates in Malone at Saranac Lake, St. Joseph's, as well as some more locations down here like Center for Recovery in Glens Falls, or at the HFM Prevention Council with Mr. Krause.
Yeah, if you're here in Hamilton County, really going through community services is really a good place to start, partly because they put an emphasis on mental health counseling, and they're doing a lot more with telehealth. But if then there's the need to get someone into medically assisted treatment for opioid dependence, really involves going pretty far. I mean, Glens Falls, Saratoga hospitals. The earliest medically assisted treatment was, you probably heard of methadone. That's been around, and James can talk about this a little bit, so I'll just start with it. Methadone's been around for a long time. It's used to reduce the cravings as far as opioid use disorder, but it has a lot of potential potential downsides, including it does have a high overdose potential and a pretty high abuse potential. So the newer ones like buprenorphine are don't have that potential for abuse because they level out. And so they're taken to basically replace the opioid that you become addicted to. But it needs to be done on a regular schedule basis in a medical setting. So that's hard for a rural area. It involves traveling to Gloversville or Amsterdam or somewhere else.
So, and I will add, part of the grant I'm currently working on with the AHAC system is to try to get more rural providers. You do not have to be an addiction specialist to prescribe Suboxone. You just have to get a Data 2000 waiver training. And that's something we're providing free of charge to any prescribers in Hamilton County or who serve people in Hamilton County to try to get more medication-assisted treatment available to people in the area.
So those waivers have to a large extent come about because of COVID, because they know it's harder for people to get treatment. I know some places, say in New York City, they've started to give waivers to allow methadone to be delivered to patients rather than you have to go into a clinic. There's been federal regulation of methadone for a long back to the 70s, where if you got into treatment for methadone, you would have to go to this clinic and go every day, and that's a lot of cost and a lot of easier if you're in an urban area, but it's still not easy. If you're in a rural area, almost impossible. So there's been a movement to try and reduce the regulation of the different MATs. But is that correct? That's come about largely because of the COVID shutdown?
There's with methadone, yes, but the problem is you still have to be affiliated with a methadone program, and like we said, it's hard because you have to have a patient travel to the clinic daily to receive doses, and if that's St. Mary's in Amsterdam, or if that's down in Albany, or if that's I believe Plattsburgh as well. But for a lot of people, that's a daily trip of 60 plus miles, and it's just not going to work for people who reside in Hamilton County and still want to. So the big push has been for the last few years, since the early 2000s, to try to get more Suboxone prescribers out there. And there are continuing research into things like Withdrawal and Juvia that are once a month injections to try to also get less abuse deterrence. That it's an injection, not something you take home like a prescription, but also to not have people who would need to go to methadone clinic daily. But it's a continuing emerging field, and we need more people to get into it, whether it's a KSAC or clinical social worker, or even if you're a medical provider, there are opportunities to help your community members who have this disease.
Now, where can people go for more information on this subject?
Well, there's up here. There's a lot of sources. We have a lot of information on opioids and substance abuse in general at our office. We're in Speculator. We're on the corner of Route 8 and 10, right in the heart of Speculator in the Howard Hanna office building. We have extensive collection of brochures, very up-to-date stuff on this issue. Hamilton County Community Services on White Birch Lane and Indian Lake. Really, those are the two, and also Public Health, White Birch Lane. So those are, I think, the three main sources here in Hamilton County. We're trying to get more stuff out into libraries, especially brochures, and other public locations. We have stuff in some of the meal sites up here, the senior meal sites. So that's, I'll just speak, since I work only in Hamilton County, those are the main places. But there are lots of really good, you can go to the federal websites like SAMHSA, the CDC, there's many good sites where you can learn more about opioid addiction and treatment and substance abuse in general.
Are there any national sort of databases that people could go to, James?
Yes, the Substance Abuse and Mental Health Services Administration, SAMHSA, is the federal agency that oversees a lot of the addiction treatment throughout the United States. New York State OASIS, New York State OASAS.newyork.gov, is a state statewide agency that oversees addiction services. And both agencies, they kind of run the gamut. They do a lot to do prevention, they do a lot to do treatment, and they do a lot to maintain recovery. And that's a continuing field that's growing, is to try to help people who maybe they have gone through all of this already. And it's an extremely difficult process, but now they're done with their 28 days and they're re-entering their community, connecting with families and jobs again. How do we help them maintain a sober lifestyle, or a substance-free or medication-assisted lifestyle now that they're reintroduced to the same community?
All right. Well, as always, I'd like to give my guests the last word. So, James, is there anything else you'd like to mention on the subject, or anything you would like to try and mention to my audience?
I say the biggest thing with trying to do prevention and trying to help people with recovery is to ask yourself, are you building the foundation for addiction in your life? It can happen to anybody. But much like every other disease, there are risk factors, and there are things that we are doing and not doing to increase our likelihood. And a lot of that has to do with a lot of what Mr. Krause focuses on, with alcohol, with marijuana, with a lot of the other drugs, as well as how do we strengthen families, how do we strengthen communities. A friend of mine, Judy Moffitt in Glens Falls, always says the opposite of addiction is connection. The more we can connect with everyone, the better we'll be.
Yeah, I would echo what James has said. We really understand now that really understanding what the risk factors are for addiction and substance abuse in general, and that we really try and start young, working in the schools, not only educating about these issues, but also programs that really try and intervene and find particular young people who may be at risk is really, really important. And we also understand that strengthening the protective factors, community connectedness, and just having things for kids to do, understanding where there's family conflict, all these things that contribute to kids maybe trying something, and the risks of being a teenager, risk taking, trying new things, trying substances is definitely always, not to say always going to be there, but it's always part of the teen and adolescent years where your brain is still developing, and that's also all very dangerous time, because just the fact that your brain is still developing makes you more at risk for addiction. We know the data on this is that the younger you start with a substance, the more likely, whether it's tobacco or alcohol or anything, the more likely you may develop a lifelong problem. With the opioid crisis, unfortunately, just the early onslaught of overprescription of pain medication. Now we have millions of people who really are suffering from opioid use disorder. Going into treatment is no guarantee that there's going to be a cure. Relapse is very common. So this problem is going to be with us for a long time. We've come a long way in understanding that addiction is a chronic brain disease. We know a lot of things that work. We know medically assisted treatment works. We know counseling, support, recovery housing, all are parts of the picture, and we need to put all those pieces together. I think we really come a long way, but unfortunately, as far as the opioid crisis, it's still with us. It's probably going to be with us for a long time, unfortunately.
All right. Well,
That's my last word.
Well, I'd like to thank my guests, James Norton and Patrick Krause. I'm glad to have been able to have this discussion with you. You can find this on our YouTube page at youtube.com/DacklinRadio. And of course, you can always listen in at www.dacklinradio.com. And until next time, I hope everyone has a wonderful day. Take care.